All right. Let's talk now to Jeff. Hi, Jeff. How you doing?
Hi, Doctor. Thanks for taking my call.
Sure.
I have two issues I've gotten on an MRI report. I have a non-displaced fracture of the medial sesamoid bone in my foot.
Oh, that must hurt.
Yeah, I've had...
How'd you acquire that?
I kicked something pretty hard.
Oh, okay. Did you get mad?
Yeah.
Oh, okay.
I learned my lesson.
You don't play Major League Baseball, because they can revoke your contract for that, you know?
Yeah. It's a good thing I'm not much into sports anyway. But
okay.
I've had it for like 5 months.
That's what K-Rod did with his hand who played for the Mets. You know, he got frustrated, banged his hand, and...
Oh, he smashed his hand?
Yeah, smashed his hand. So anyway, sometimes the worst injuries that we acquire, we inflict on ourselves. It's often the case. Anyway, go ahead.
I've had it for like 5 months now, and it's still pretty swollen. And I've heard so many different things. You know, it might need surgery because it takes, if it's not healed within 6 months, forget it. Some people say it takes a year.
Yeah. Well, what happens when you have these injuries is you can get post-traumatic arthritis. How old are you?
I'm 42.
42. Do you have any other forms of arthritis? Do you have sore knees or sore shoulders or sore fingers?
I do have psoriasis because I've been researching this a lot.
I mean, that's a form of an inflammatory disorder where there is something referred to as psoriatic arthritis. And you may not have full-blown psoriatic arthritis, but you may have a little more tendency to create inflammation. And trauma is an instigator of inflammation. So anyway, are they saying that you need surgery, or they're not sure, or, they don't know what to do with this?
Telling me too much of anything. He's like, just wait 2 months, don't worry about it.
Yeah. I would first of all, I would see a rheumatologist for an opinion as to whether you're developing psoriatic arthritis, because psoriasis is a clue. But, then handed that diagnosis, there's not much they're going to do except give you anti-inflammatory medication. And generally, the non-steroidal anti-inflammatory drugs delay healing, so they're not that great for this kind of thing. When you have a poorly healing injury to your bone, it's important to check your vitamin D levels. So I would get a vitamin D level. I would also probably start taking 5,000 international units of vitamin D, because that's not going to hurt you and it might hasten healing. I would take a look at your diet, because this injury may be sort of a sensitive barometer of where you're going in terms of arthritis in general. And you may want to, given that you have psoriasis, there's just a study out, and I talked about it in this program, that suggests that beer can worsen psoriasis. So I say, hooray, they're finally recognizing that there are certain food components that actually have an impact on psoriasis, because before that they said, forget diet doesn't have an impact, you can eat whatever you want, it's not going to make a difference. Well, it does. Beer is rich in yeast, it's rich in barley, which is a gluten, and there's a much higher incidence, according to the study, of psoriasis in beer drinkers. Not that you can be a teetotaler, you can't have psoriasis, you can, but you increase your likelihood with foods that set these things off. So, wheat, gluten, dairy products, the nightshade family of tomatoes, eggplant, green peppers, and tomatoes may have an impact on psoriasis or arthritis. And, my suggestion is there may be an inflammatory component. It may be, or alternatively, you may need surgery because after that fracture, there's a fragment that's impinging there and creating a problem. But before going under the knife, because I've seen people go under the knife for arthritis, and then it doesn't help because they miss the fact there was an inflammatory component. I think you'd want to make sure, with a rheumatologist's opinion, that this is not a sign of inflammatory psoriatic arthritis, or the beginnings of it. All right, Jeff, I'm Dr. Ronald Hoffman, and this is Health Talk.